Hi, Mr. and Mrs. Smith. I'm your nurse, Gina. I wanted to go over some information with you about Susie. As you know, Susie was diagnosed with cystic fibrosis, and I just want to go over some information so you have a better understanding of it. Cystic fibrosis is a disorder that affects the lungs as well as other organs due to an increase in mucus secretions, and those secretions can obstruct organs such as the lungs, the intestines, even the reproductive system. So, some signs and symptoms that you will notice are going to be coughing and wheezing and shortness of breath. Other symptoms may include large, frothy, foul smelling stools, constipation, weight loss, thinning of the arms and the legs, and anemia, and more. Okay, so I'll provide you with some further information about other signs and symptoms that you may notice on that, but those are going to be the ones that you're going to notice the most. Oxygen. Now, it's important that Susie goes and attends all of her doctor's follow-up appointments with her doctor. However, it's also important to know when to seek medical attention immediately in case of an emergency. And those signs would be an oxygen saturation drop, a sudden oxygen saturation drop, difficulty breathing, chest pain, weight loss, blue lips or the nail beds or blue tinted, worsening of the symptoms such as the cough or a change in the mucus secretions. It's also important to just keep notice of all of those things. Some of the medications that you'll be giving Susie are respiratory medications such as albuterol, as well as pancreatic enzymes and vitamins. During a time of infection, an antibiotic can also be administered. In addition to the medications, you'll be assisting Susie with chest physiotherapy, and I'll go over that with you in a bit. But first, do you have any questions of what I've said to you so far? Oh, okay, great. Let's go on to chest physiotherapy.